Hello. Welcome to Care for You, the project that is built to help you develop your skills as a senior caregiver. This course is about ethics. This competence was included as one of the most important competencies for seniors caregivers. For this introduction, it is important to say, regarding senior, each senior is unique and may be in a situation of greater vulnerability. Regarding caregiver, it is fundamental that the caregiver knows the ethical principles and understands how this competence can promote the health of senior. For that, need to recognize the basic elements inherent to the development of ethical competence. About ethical issues, we highlight the senior's autonomy, respect for seniors' needs, wishes and values, and respect for seniors' decision-making. In the end of this course, you should be able to understand the specific dimensions of ethics in senior care contexts, recognize the requirements of ethics, understand the value of ethics for the quality of senior care and the promotion of well-being of senior population, reflect on your personal needs regarding ethics, and develop ethical reasoning skills. But first, it is essential that we begin with the definition of ethics. Professional ethics is a set of moral principles, beliefs and values that guide you in the best decision. Ethics, the sense of right and wrong, the standard rules or principles that guides you. Some of the guiding principles can be visualized in the figure. These principles were adopted by the United Nations in 1991. For more information, see the complementary material of the course. Now, let's talk about the requirements for working with seniors. Are you really aware of the ethical principles and imperatives that you should consider? It is crucial that you attend to a set of ethical principles and imperatives. We will present you 7 ethical principles and imperatives and simultaneously give you a few practical examples. First, respect for human dignity, regardless of the stage of life. You should recognize senior as a unique being and attend to senior's preferences. Don't forget to address senior by the way he or she likes to be called. Second, recognition of the senior singular situation. Don't assume that all seniors are similar or have similar needs. Try, therefore, to know senior in all his or her globality and uniqueness. Third, freedom of senior decision, which materializes in respect for autonomy. Choose, for example, not to replace senior if he or she doesn't need it. Choose to offer several alternatives, leaving it up to senior to decide. Fourth, recognition and protection of the senior vulnerabilities. Be particularly aware if senior is more vulnerable than expected. If so, senior probably won't be able to defend yourself and enforce his or her rights. Fifth, ethical demand and social responsibility in caring of senior. Look at each senior as a person who has, and will be able to make, a special contribution to society. Sixth, no age discrimination. Protect senior from any age-related discrimination. Don't forget to reflect on your own representations about senior. Consider that your representations determine your speech and behavior with senior. Seventh, orientation towards conditions of integral well-being and quality of life. You will take this ethical imperative into account if you do not think and act according to erroneous ideas, such as, at your age, it is normal to have pain. And now, do you understand how the development of professional ethics competence can promote the health and well-being of senior? We hope that your care contributes to a good life for senior. It is important that you have in mind that, if you are not competent from an ethical point of view, you will not be able to make the best decisions, consulting senior, or identify, much less apply, the ethical principles. This scheme highlights the idea. Ethics help us to walk in a good direction towards the health and well-being of seniors. So, synthesizing. First, ethics, the standard of what is right and wrong. Second, it is essential that you recognize and apply ethical principles and imperatives. Third, the more developed your ethical competence, the better you will be able to help senior to achieve a good life. When you work with seniors, there are innumerable ethical issues and challenges. Therefore, it is very important that you can be aware of your knowledge and your own boundaries, so you can recognize the ethical issues that could arise from different situations in practice. Nowadays, the most common ethical issues when working with seniors are related to autonomy, respect for their needs, wishes and values, respect for their decision-making, and confidentiality. Some examples are misunderstood concepts about age, seniors' ability to make decisions or to perform actions. Likewise, it's common to have someone disrespecting confidentiality or personal privacy, or not asking for informed consent. For this reason, developing the process of ethical decision-making will help you to develop your professional identity as a caregiver. That will allows you to reflect upon ethical values, and helps you see senior as someone unique in that specific situation. Now we will introduce you to some examples regarding ethical situations. Firstly, consider this case scenario. During the morning, when a professional caregiver is helping Mrs. Duval, a senior with moderate dementia, she slipped and fell in the bathroom. Besides a few bruises in the right arm, and after a medical observation, Mrs. Duval is okay. However, the professional caregiver asks you not to talk with others about the situation. That day, when the family comes to visit, they see the bruises and ask her what happened. Mrs. Duval says she probably hit her arm in the bed. Worried and very anxious, the family ask you, "Is this was really what happened?" So, what will be your answer? What would you do? Now, take a look at another example. Your best friend has just found you a job in the residence where he works. Usually, he is very kind to seniors, but after a few weeks you start to realize his behavior sometimes changes. When seniors refuse to help him in the daily activities, he easily raises his voice and tells them that it is their job to help, if they want to be autonomous. What do you think about the situation? What would you do? So, in order to help you develop your ethical skills, we propose the use of ethical frameworks. Firstly, and in a simple way, we can emphasize three important questions when dealing with ethical decision-making process. First, is it safe? Second, is it correct? And third, is it kind? By asking these questions, the aim is to brought up your ethical code and values, as well as valid norms and rules. Moreover, it will demand your compassion and ability to act in a correct ethical manner. However, most of ethical decision-making frameworks reported in health and social care are the so-called step-by-step models, because they include several steps, developed in a subsequent way, to address the ethical problem. For instance, the 6-step ethical decision-making process presented in this figure is an example of an ethical decision-making process, and it will be the one we use throughout this course. Now let's go back to case scenario 1, about Mrs. Duval, and use the 6-step model. So, when you think about the situation, can you clearly identify the facts and recognize there is an ethical issue involved? In this case, Mrs. Duval fell in the bathroom, and your colleague asks you not to tell anyone. However, when the family sees the bruises and ask Mrs. Duval what happened, she does not recall, so the family asks you. Now you need to decide. Will you respect your colleague's request, or will you tell the family? Moving on to step 2, once you've recognized the problem, you need to identify who are the people involved. In this case, Mrs. Duval, your colleague, and the physician who treated Mrs. Duval were directly involved, but you still need to consider the involvement of the Mrs. Duval family and the institution itself, because its reputation could be threatened. Also, you need to think about the situation. Are there any unique factors you need to consider? For example, how the incident should be approached. What was the cause of the fall? Could it be avoided? Who is responsible for the situation? Now, going a step further, you need to consider what are the relevant facts, laws, principles and values involved. First, your colleague's request, meaning confidentiality. On the other hand, the recognition and protection of the senior's vulnerability and social responsibility and caring, places you in an ethical demand. Additionally, Mrs. Duval is a senior with moderate dementia. So, what do you think your professional behavior should be? Should you keep your colleague's request, or is it a wrong request? Or, should you protect the patient and provide the best care? Second, does the residency have any specific policies on senior care? For example, security policies, or fall reporting? If so, what are the recommendations? And third, can anyone advise you in this situation? Is there someone more experienced you could consult? What do you think someone wiser will do? In step 4, you need to establish and analyze what are the potential options. Let's see 3 different possibilities. Option 1, you choose to be apart from the situation, and your answer is, I don't know, I didn't saw what happened. If you choose this action, a passive strategy, you may think you're respecting your colleague request and confidentiality, but you're not respecting the patient or the family by hiding information. What if it was someone you know? A family member? How will you feel about it? What will be the advantages and disadvantages of this course of action? Or, you can simply say, I can try to find out, but the important now, is that Mrs. Duval is okay, and this would be option 2. So, you get involved in the situation, but you hide true information about what happened. That way you avoid family distress. However, if you choose option 2, you're choosing a passive strategy again, because you're still hiding the facts and not facing what happened. Finally, in option 3, you tell the truth about how Mrs. Duval felt in the bathroom, and tell the family she has taken good medical care. Afterwards, you will also talk with your colleague about it. Now reflect upon the 3 options above. Which solution do you prefer and why? What decision will take into account ethical principles and respect Mrs. Duval? Now, in the face of all the arguments, you need to choose the course of action. If you choose option 3, assure you tell the true facts, without accusing or judging anyone, and help to keep the family calm. In this case, you're respecting Mrs. Duval, her family, and you're acting according to principles like recognition and protection of the senior's vulnerabilities, ethical demand, and social responsibility and caring. You're thinking about senior's best interest. Regarding your colleague, choose a good time to approach him or her, do not judge, and try to understand the reasons for that behavior. Maybe he or she was afraid of being punished, or getting fired. Although you're not attending her request, this is not a matter of confidentiality, so help your colleague to understand why this is not good professional behavior. Support your colleague developing the right attitude and behavior, and how to cope with these incidents in professional practice. Give her or give him the possibility to raise the awareness on these issues, so this will lead to future changes. If possible, look for institutional policies and recommendations. Finally, in step 6, after you implemented the action, assess the outcomes. What were the reactions to your decision? How did your colleague react to your approach? What went well? And, what could have been better? In this case, what have you learned? How can it be applied in the future? Just take some time to reflect. Now that we have used the ethical framework in case scenario 1, let's go back to the second example. Will you be able to use the 6-step model in this situation? Just go and analyze all possible issues and options in this case. So, were you able to do it? Good. That's how you can develop your ethical decision skills. So, in order to summarize, you want you to remember that working with the seniors means you can face several ethical challenges and dilemmas, but using an ethical framework can help you in ethical decision. That way, keeping ethics as an essential aspect of practice and care means you can guarantee a better quality of life for seniors and their caregivers. And don't forget, if you want to know more about ethics, just go and check the links we present you in the following handout. Hope you have enjoyed this webinar. Thank you for watching.